Hello everyone, I am Dr. Alka Pareek, Associate Professor, Department of Home Science, Government Girls College, Sikandra, Dausa, Jaipur. Today I am sharing a very common and major problem of your area, that is Chaksu Tehsil of Jaipur district, and it is fluorosis, which is caused due to excess intake of fluoride in water. First of all, I wish that you all are fine in these times of COVID-19. It is really very difficult to survive in such times, and I hope you are following, all the students are following the measures of SMS, that is social distancing, mask and sanitization. So we'll start our today's topic, that is problems of fluorosis in Rajasthan, specifically Chaksu Tehsil of Jaipur district. Any deformity is a curse, more so if it is a disabling deformity. The life of a person becomes miserable if the deformity is permanent and lifelong. Fluorosis is also a type of crippling deformity and is a public health problem in several parts of our country, including Rajasthan, Jaipur and Chaksu Tehsil. In today's presentation, I would like to discuss firstly about the introduction, that is what is fluorosis, its prevalence particularly in Rajasthan and Chaksu district, then what are the causes and risk factors of fluorosis, why it is caused. It is very important if you want to rule it out. Then mechanism of fluorosis, signs and symptoms of fluorosis. You all know the fluorosis is of two types. When it affects the teeth, it is known as dental fluorosis, and when it affects the skeletal system of adults, it is known as skeletal fluorosis. Sixth point is diagnosis, and last but not the least is prevention and control. Excess fluoride in water and diet can lead to fluorosis. The most frightening aspect of the disease is that once it finds a home in the body, it does not leave it. Although it starts destruction immediately, it sometimes takes up 2 to 3 decades for the disease to completely manifest itself. Ingestion of excess fluoride, most commonly in drinking water, affects teeth and bones. As said earlier, it results in major health disorders like dental fluorosis and skeletal fluorosis. And there is one more kind of fluorosis, non-skeletal fluorosis. People exposed to large amounts of fluoride show dental effects much earlier than the skeletal effects. Dental fluorosis affects children and discolors and disfigures the teeth, while skeletal fluorosis affects bones and the major joints of the body like neck, backbone, shoulder, hip and knee joints, resulting in severe pain, rigidity or stiffness in joints. Severe forms of skeletal fluorosis result in marked disability. Non-skeletal forms of fluorosis are earlier manifestations which develop long before the onset of typical changes in teeth and bones. Apart from these, there are gastrointestinal symptoms, and these may overlap with other diseases leading to misdiagnosis. It affects men and women as well as children of all age groups. Now, you will ask, what are the permissible levels or limits of fluoride in water? So, according to WHO, the standard fluoride in drinking water standard levels are 1.5 milligram per liter, but 0.5 milligram per liter has been favored in 2000 AD by international workshop in Thailand, and we say that the permissible limits are from 0.5 milligram to 1 milligram per liter per day. Now, this picture shows the prevalence of fluorosis in the world. The area which are darkened, they show the high prevalence of fluorosis. In India, occurrence of fluorosis was reported from different states, namely Andhra Pradesh, this is Andhra Pradesh, then Rajasthan, Punjab, Gujarat, Karnataka, Tamil Nadu, Delhi and Haryana. 15 states of India are endemic for fluorosis, and they are Bihar, Delhi, Andhra Pradesh, Gujarat, Haryana, Karnataka, Maharashtra, Madhya Pradesh, Orissa, Punjab, Rajasthan, Tamil Nadu, Uttar Pradesh, Jammu and Kashmir and Kerala. In Rajasthan, fluorosis has been reported from various districts like Jaipur, Dungargarh, Sardarshahar, Bikaner, Savai Madhopur, Ajmer, Udaipur and various other districts. So now we come to Jaipur. In Jaipur, my study was conducted on Chaksu Tehsil of Jaipur district, and it was found that 97% of the population was suffering from fluorosis. Both males and females suffered from it, and even children had high prevalence of fluorosis because the study was basically conducted on people who were residing in Chaksu Tehsil since past 15 years. So 97% had skeletal fluorosis, while 100% population was suffering from dental fluorosis, and 91% were suffering from non-skeletal fluorosis. Then in Jaipur, apart from Chaksu Tehsil, Sanganer Tehsil is also reported to have high amount of fluorides in drinking water. Now we'll discuss the various factors which are responsible for causing fluorosis. Fluorosis is caused by continued excessive ingestion of fluoride over a long period, and the fluorides are consumed in water, in food, air, and even in toothpaste also. There are high content of fluorides in the toothpaste. However, drinking water is the most significant source of fluoride. Then, apart from high concentrations of fluoride in drinking water, like Chaksu Tehsil has 7 to 14 ppm fluoride, whereas the permissible limit is 0.5 to 1 ppm of fluoride. So you can see that from 1 ppm up to 1 ppm is the permissible limit of fluoride, whereas we people who are living in Chaksu Tehsil, we are consuming 8, 10, 12 or 14 ppm of fluoride in our drinking water. This is the main reason why we all are suffering from dental and skeletal fluorosis. Now, apart from water, there are certain other factors also. We call them risk factors because they increase the toxicity of fluoride, and they are ready to serve foods which are available in the market, beverages like cold drinks, tea, coffee that contain high amount of tannin and caffeine, snacks which contain black rock salt, which is known as kala namak, and red rock salt. Then tobacco or supari, that is areca nut, they also contain high quantity of fluoride. So if tobacco or supari is taken in betel leaf, that is पान के साथ जब भी हम सुपारी या tobacco लेते हैं तो it increases the toxicity of fluoride. Then intake of certain drugs and medicines are taken in diseases, but these drugs and medicines, they increase the toxicity of fluoride, such as fluoroquinone, antibiotics, few antidepressants, some antifungal drugs, cholesterol lowering drugs, steroids and anti-inflammatory drugs, drugs for arthritis, antacids, drugs for osteoporosis, osteosclerosis. They all contribute to fluoride toxicity over a longer period of time. Then persons with calcium deficiency or malnourished individuals, they appear to be more prone to develop dental and skeletal fluorosis. And particularly when we talk about nutrition, so particularly the deficiency of protein, calcium, phosphorus and vitamin C, they contribute as risk factors for the development of this disease. One very important risk factor is fluoridated toothpastes. Indian studies have shown that the absorption of fluoride takes place within minutes after brushing the teeth with fluoridated toothpastes. And I don't know whether you all know or not that in various depths of a toothpaste tube, there are from 800 ppm to 1000 ppm of fluoride. Then fluoridated beverages, they are also reported to be the risk factors. Then fluoride rich foods such as tea. Some people, they consume 8 to 10 cups of tea per day. They have the habit of drinking tea after say every meal, or off and on they drink tea. So tea is the major source, and 1 cup of tea may contribute from 50 to 60 ppm of fluoride. Then ocean fish, gelatin, skin of chicken, fluoridated salt, food contaminated with post-harvest fumigants such as sulfuryl fluoride, and pesticides. You all are students of agriculture, and so you must be knowing very well about fumigants and pesticides, that they contain high amount of fluoride. Pesticides contain sodium aluminum fluoride. So if we consume crops with fumigants and pesticides, then the risk factor for the disease increases. Then fluoride from any other environmental source such as cigarette smoking and industrial pollution, and others involved with power, welding, water fluoridation plants, refrigeration, rust removal, oil refining, plastics, pharmaceuticals, toothpaste, chemicals and automobiles. Then climate is one more factor for increasing the toxicity of fluorides. The areas with semi-arid tropical conditions So people living in such areas, they are more prone to this condition, and particularly people who drink well water, and because well water it stays in connection with rocks, and so when rocky water is consumed, so rocks contain fluorides, and the rocky water in rocky water the amount of fluorides increase, so the toxicity increases, and then the consumption. Other risk factors are nutritional. Firstly, diets rich in fat have been reported to increase deposition of fluoride in bones. Then dental fluorosis can also occur if the fluoride exposure during first few years of life, when the teeth eruption is taking place. So if the teeth eruption place is an endemic area, then the chances of dental fluorosis increase. Now the mechanism of fluorosis, how the disease is caused. Once fluoride enters the body, either through blood vessels in the mouth or through the gastrointestinal route, it reaches various organs and tissues in the body. As you all know, fluoride is an electronegative element and it has negative charge. It is attracted by positively charged ions like calcium, which are present in our bones. Bones and teeth have highest amount of calcium in the body, so they attract maximum amount of fluoride, and it is deposited as calcium fluoroapatite crystals. At the same time, from certain areas in the bone and tooth, the unbound calcium is lost, and thus the disease occurs. Now we come to the symptoms of the disease, that how we can detect that the person is suffering from dental or skeletal fluorosis. It is not essential that all the symptoms of fluorosis are present at the same time. The severity and duration of the disease depends on, firstly, person's age, his or her nutritional status, environment, kidney functions, amount of fluorides ingested, genetic background, tendency to allergies, and other factors such as hardness of the water due to the presence of calcium and magnesium. Fluorosis in its mild form affects the teeth of children and is known as dental fluorosis, while in its severe form it affects the skeletal system of adults and is known as skeletal fluorosis. First of all, we'll discuss about dental fluorosis. Dental fluorosis is prevalent in children who are born and brought up in an endemic area of fluorosis. Dental fluorosis can occur both in milk teeth and permanent teeth. Discoloration due to excess fluoride intake is visible to the naked eyes. Now in subsequent pictures, I'll tell you about the different grades of fluorosis that are prevalent in your area, that is Chaksu, Tehsil of Jaipur district. For this, it is very essential to see what is the normal condition of teeth. So in picture, you can clearly see the normal dentition. Smooth, glossy, pale, creamy white and translucent surface of teeth is considered to be normal. Now let's see what happens in dental fluorosis. Now this is the first grade, that is, it is said to be questionable. In this, you can see white flakes or flecks to occasional white spots on the teeth. In human beings or in children who consume drinking water more than 1.5 milligram per liter or more, in such children, dental fluorosis is seen of different grades. Now what happens? The disease affects the teeth, and glistening white teeth, as you saw in the last picture, they have lost their shiny appearance in this picture. They have become dull and chalky white patches appear on them, which is known as mottled enamel. And this is the early sign of dental fluorosis. The white patches later become yellow and sometimes brown or black. Now this picture depicts very mild symptoms of dental fluorosis. Small, opaque, paper white areas scattered irregularly over the tooth, but involving as much as 25% of the tooth surface. Now this is mild dental fluorosis. The white opaque areas in the enamel of the teeth are more extensive but do not involve as much as 50% of the tooth. This is moderate dental fluorosis. The enamel surface of the teeth are affected and the surface subject to attrition show wear. Brown stain is frequently a disfiguring feature. This is a severe condition in which all enamel surfaces are affected. Discrete or confluent pitting you can see in the picture. Brown stains are widespread and teeth often present a corroded like appearance. In severe cases, the loss of enamel is accompanied by pitting, which gives the teeth a corroded appearance. The teeth also become brittle and porous. Mottling is best seen in incisors of the upper jaw. Such teeth that you saw in pictures destroy the smiles of young children, and they feel shy while talking to unaffected persons. It is mainly confined to the permanent teeth, but in severely endemic areas, deciduous teeth may also be involved. Once mottling occurs, it causes permanent defect in the teeth and there is no cure for it. In later stages, the whole tooth may become black, it becomes pitted or perforated and may even get chipped. Now the real problem due to fluorosis starts after 3 to 4 decades of residence in a fluoritic area, as the skeletal system starts getting affected. Young people are never cheerful and healthy, as you can see in the pictures, because their limbs are weak and they experience numbness and tingling sensations in the extremities. This is followed by pain and stiffness of the back, painful joints, and limitation of neck movement. Due to these changes, a 25-year-old man looks like an old man. The numbness later results in paralysis. The backbone becomes stiff and the patient develops what is known as poker back. The back may bend completely and become stiff. An affected person cannot get up or lie down easily and becomes bedridden and paralyzed. These are the pictures of different neurological complications due to fluorosis. Once a person develops such deformities, it is irreversible and makes him physically, psychologically, economically, and socially handicapped. These all are associated with muscle weakness, stiffness, pain, and loss of muscle power, and patients are unable to carry out normal routine work. So dear students, because the fluoride content in your region in water is very high, more than permissible limits, rather I must say very much more than permissible limits. So prevention is better than cure. It is said for all diseases, but particularly it is very true for fluorosis, because earlier we have studied that once the changes are there in the body, they are irreversible. So for prevention of fluorosis, the basic key is to avoid intake of fluoride by individuals and community. Excess fluoride intake and its adverse effects can be minimized or prevented by adapting some measures, such as number one is using alternative water sources. Number two, by defluoridation of water. Defluoridation means removing fluoride from water. And thirdly, by improving the nutritional status of the population or individuals who are at risk. Now, what can be the alternative water resources? So they can be surface water, because the waters of deep well are rich in fluoride. Rainwater and low fluoride groundwater can be the best sources. Then defluoridation of water. Use of safe drinking water with safe fluoride level is the preferred option for the prevention of fluorosis. However, access to safe water in fluorosis endemic area is limited. The defluoridation is the only solution, that is, removing excess fluorides from drinking water. And this can be done by different methods. Chemical method, by using alum, and the technique is known as Nalgonda technique. Then adsorption and ionic separation method. The other method for prevention can be improving the nutritional status. So the measures to improve nutritional status are increasing the intake of calcium and vitamin C, iron and antioxidants. Because if we increase the intake of all these nutrients along with protein and vitamin D, then fluorides are not absorbed by the body, or at all, if at all they are absorbed by the body, then they will not replace calcium. Mothers in affected areas should be encouraged to breastfeed, since breast milk is usually low in fluoride. So in Chaksu Tehsil, when the nutrient intake was assessed, it was seen that the protein intake by male and female population was 85 and 86% of the RDA respectively. Calcium intake was also low. Similarly, vitamin intake was only 32% by males and 33% by females. Similarly, the intake of energy and vitamin C was also lower than the prescribed RDA. So we can say that the diet plays a very important role in combating fluorosis. So the measures we have already discussed about diet and defluoridation of water. One or two things more I would like to add to it, that eating amla should be promoted among rural children. because आंवला is very rich in vitamin C. हम आंवले को सन में ड्राई करें, वो बॉईल करें, कुछ भी करें, उसके बाद भी उसके अंदर इतना विटामिन सी होता है कि एक दिन की रिक्वायरमेंट इजीली फुलफिल हो जाती है. Similarly, fluoridated toothpaste and mouth washes should be banned in endemic area. They should be banned by the government. And the intake of energy, protein, calcium, vitamin C and vitamin D should be promoted. I hope you liked today's topic because it was relevant to your area. Thank you so much for your patient hearing. Last but not the least, I take this opportunity to thank sufficiently and profoundly my mentor and guide, Professor Dr. P.N. Kalla, Dean, Faculty of Sciences, Jagannath University, Chaksu, Jaipur, for having invited me to deliver this online talk. Dr. Kalla has been keenly involved in research and teaching and extension not only in the area of agricultural sciences but many other fields too for the past more than 40 years. I feel proud to be one of his many pupils who are still actively associated with him. Professor Kalla specifically suggested fluorosis as the topic of my presentation specifically for the students of Jagannath University, since the subject area entails huge importance because the fluoride content of Chaksu Tehsil has been reported to be very much higher than the permissible limits of 0.5 to 1 ppm as suggested by WHO, and is fast causing dental and skeletal fluorosis in hundreds and thousands of people residing here. I hope today's presentation would prove to be fruitful in understanding and combating such a serious problem of your region causing great amount of physical deformities. Thanks to everyone.